Good evening, my name is Brendan White and this is a video discussing the different medications which are usually used by EMT basics. Some of these medications are usually transported or usually carried on an ambulance. However, in the field, some of these medications are used by persons who have been prescribed with these medications and where assisted and are used for assistance in the field. I will begin by listing these medications. Some of these medications used by EMTs are oxygen, oral glucose, aspirin, nitroglycerin, activated charcoal, metered-dose inhaler, or some will refer to it as albuterol. I will begin by describing by describing each and the correct dosage and the route in which they should. Oxygen. Oxygen is a medication which is widely used by EMTs. We firmly believe that no patient should be withheld oxygen if they are in need. However, there are indications and there are contraindications for using oxygen. The indication for using oxygen are patients who are suspected of having hypoxia, suspected of having labored breathing, suspected of having respiratory distress, or suspected of having a shallow respiratory rate without adequate rise and fall of the chest. The contraindication for using oxygen are patients who have an inadequate airway, patients who have an obstructive airway, patients whose airway is not adequately open. Oxygen is transmitted per us or intranasally. Per us is usually by non-rebreather mass. The correct dose is 15 liters, 100% oxygen. For a nasal cannula, it's normally between 3 to 6 liters on low flow oxygen. The next medication which I will describe is called oral glucose. Oral glucose is used for patients who are suspected of having hypoglycemia, or in layman terms, low blood sugar. The contraindication for using oral glucose are for patients who are unresponsive, who cannot swallow or swallow on their own. If the patients cannot swallow, that means that the aspiration will flow into the back of their throat where it will be relaxed and not ingested, thereby causing an obstruction in the airway. Oral glucose is transmitted per us through the mucous membrane. The normal dosage is basically 1 tube rubbed in the mucous membrane. The next medication in which I will tell you about is aspirin. The indication for using aspirin is for patients who are suspected of having cardiac-related problems, and this may be described as a simple myocardial infarction. The dose is transmitted per us, and it is basically used to ease the symptoms of myocardial infarctions or for simple chest pain. The contraindications are gastrointestinal bleeding, patients of severe trauma. Also, the normal dosage is normally 4 pills. Aspirin is usually 81 grams each. The next medication I will be telling you about is activated charcoal. Activated charcoal, this is a medication which is used for patients who have suspected of having oral poisoning or who have suspected of ingesting an poisonous substance. Contraindication for these is for patients who have ingested corrosive liquid, patients who are suspected to have ingested poisonous petroleum liquid base. They indicate the correct route for using activated charcoal is normally per us. The next medication in which I'll be dwelling into is metered-dose inhaler, or what you will call albuterol. Albuterol is used per us. It is usually 2 puffs. You wait 5 minutes or less until the patient ingests it. The indication for using albuterol or metered-dose inhaler the indication for using a metered-dose inhaler are for persons who have severe respiratory distress, which is usually caused by spasm of the bronchiole, which is related to asthma-related illnesses. The next medication that I will be dwelling into is nitroglycerin. Nitroglycerin, similar like aspirin, is used to treat patients with suspected cardiac-related problems. This medication, however, is administered sublingually, which is basically underneath the tongue. The contraindication for using nitroglycerin is basically for anybody who is using a relaxant known as Viagra, Levantra, or Cialis. Also, another contraindication is a patient whose blood pressure is less than 100 systolic blood pressure of less than 100. And finally, the next medication I'll be going into is that as epinephrine, which is usually in the form of an EpiPen. The indication for using this medication is used for persons who are suffering from a severe allergic reaction, which is closely or usually related to anaphylaxis reaction, which also cause respiratory distress. The indication for using this is that of anaphylactic responses or anaphylactic signs and anaphylactic symptoms. The contraindication is that there is none in a life-threatening situation. Epinephrine is always given. That the dosage for epinephrine is normally one auto-injector, which is administered intramuscularly. And that concludes my video, and that concludes the discussion of medications that are carried and administered with the use of medical direction and medical control, and assisted medication administered also by the direction of medical control. Thank you very much.